Let's go to Dr. Redfield and then Admiral Giroir and then Dr. Hahn. Dr. Redfield, welcome.
Thank you, Chairman Alexander, Ranking Member Murray, and members of the committee. And I want to thank you for the opportunity to be here today. On behalf of CDC, I also want to thank you for your continued support of our public health professionals and their life-saving work that they're committed to 24/7. Over 6,700 CDC staff have been engaged in our agency's COVID-19 response so far, have been deployed to more than 200 locations, tribal nations in the United States and abroad. I know that you join me in expressing our collective deep gratitude to the women and men of CDC for their resilience, their dedication, and their service to our nation. Throughout this global pandemic, CDC has brought its science expertise to the front lines, grounded in science and data, conducting rapid investigations of disease outbreaks that identify the highest risk populations and settings, and putting in place measures to prevent further spread of COVID-19. Understanding which populations are most at risk and how this virus spreads in various settings is critical in developing guidance and protecting the health of Americans. As you are aware, in the United States, we are approaching nearly 7 million cases and sadly over 200,000 deaths. Every death means that a loved one was lost. A 50% reduction in daily cases and a 32% reduction in deaths. There's also been significant improvement in the mortality, particularly in the elderly. For example, during the peak of the epidemic, April 17th, a 75-year-old American had a mortality of about 46.8 per 100,000. And by the end of August, the numbers had significantly declined into about 10 per 100,000. These improvements, however, do not mean that we can let our guard down. Over last week, we had an average of over 40,000 cases and nearly 800 daily deaths. I do want to emphasize the shift in age in these case counts. The 18 to 25-year-olds currently make up over 26% of new infections and more than any other group. It's imperative that these young adults recognize that even though they are unlikely to get seriously ill from this virus, they are major contributors to the spread of COVID-19 in our country at this time. In order to understand the proportion remains at risk, CDC is currently performing large-scale serology testing across the United States. Preliminary results appear to show that most Americans have not been infected with the virus, still vulnerable to the infection, serious illness, and death. We hope to be able to post the analysis of the first round of this study in the next several weeks. As I've stated before, the CDC encourages all Americans to embrace the powerful public health tools that we have right now. Wear a mask, maintain social distance, practice routine hand washings with vigilance, be smart about crowds, and stay home when you're feeling sick. And as we move into the fall, I want to add one more critically important step: flu vaccination. Flu vaccination is safe. CDC encourages all Americans to embrace the flu vaccine with confidence for themselves, their families, their loved ones, and their communities. This year, CDC has purchased an additional 9.3 million doses of adult flu vaccine, as well as 18.5 million doses for children. This is a significant increase in previous years. When combined with the tools that I mentioned above, this could help our nation avert a very difficult fall and lessen the burden on our healthcare system and save lives. To further strengthen our public health resilience, CDC awarded $140 million to 64 jurisdictions through the CDC existing immunization cooperative agreements to begin to scale up staffing and preparedness for flu season. We also developed a new multiplex laboratory diagnostic test that's capable of measuring both influenza A and influenza B, as well as COVID-2, using a single specimen in a single assay. This test will help our public health professionals better identify infections with influenza and COVID. I also am announcing today an additional $200 million from the CARES Act funding that will be used as a first step to help the jurisdictions complete their individual plans and implement their COVID vaccination in follow-up to the playbook that we released last week. CDC is an integral part of Operation Warp Speed. We're leveraging our expertise and immunization infrastructure to support and promote distribution, administration, and monitoring of the future COVID-19 vaccines. In coordination with Operation Warp Speed, CDC is working closely with state and local community organizations. Their detailed, flexible plans for vaccine hearings. Now is the time to commit to sustained investment in core capabilities of public health: data analytics, laboratory resilience, workforce expansion, and rapid response capabilities. Years of underinvestment in public health infrastructure have led to a system that has been sorely tested in this current pandemic. COVID-19 is the most significant public health challenge that our nation's faced in more than a century. Now's the time to build not only the public health core capability that our nation needs, but the capability that the people of our nation deserves. As we work together collectively to fight COVID-19, to end the pandemic, CDC and all of the outstanding women and men of CDC remain strongly committed to our mission to protect all Americans from disease, threats, and to save lives. I want to thank you for your time, and I look forward to your questions.